Good afternoon. I'm Laura Lucas, Senior Manager of Provider Education for the Association of Community Cancer Centers. I'm eager to introduce Mr. Stephen D'Amato, our expert presenter for the fourth e-course of the series hosted by the Institute for Clinical Immuno-Oncology, or as we refer to ICLIO. He will address administrative challenges in implementing immuno-oncology, potential best practices, and how to prepare your cancer team for success. As you may know, the ICLIO initiative focuses on preparing the multidisciplinary team for the challenges and opportunities presented by IO and includes other vital resources such as newsletters, papers, scholars program, and a national conference scheduled for this October 2nd in Philadelphia, where Mr. D'Amato will also join us as a faculty presenter. I hope you'll visit www.accc-iclio.org to browse all of the offerings. Now for today's e-course, I'm pleased to introduce Mr. Stephen D'Amato, Executive Director of the New England Cancer Specialists in Scarborough, Maine, ACCC President, and ICLIO Advisory Committee member. He's also a Clinical Associate Professor at the University of Tufts College of Medicine, serves as a member of the Maine Medical Center Institutional Review Board in Portland, had experience in clinical oncology for 30 years in both the hospital and private practice settings. He has extensive knowledge in EMR implementation, utilization, and practice management. Mr. D'Amato has also lectured extensively on pain management, end-of-life care, and oncology practice. He's a board member of the Community Cancer Center in South Portland, Maine, a nonprofit organization providing education and support to cancer patients. And he earned his undergraduate degree from the Massachusetts College of Pharmacy in Boston. I did just want to also update everyone on a few housekeeping notes for the webinar today. Please feel free to submit questions to our presenter by typing your questions in the box on your dashboard during the presentation. We also have Jennifer Hinkle, who's a partner at the McGivney Global Advisors, joining us today to pose questions to Mr. D'Amato at the end of the presentation. The webinar will be archived and available on the ICLIO website by the end of the week. And again, our site is accc-iclio.org. Now I'll send it over to Steve to kick off our webinar today.
Lorna, thank you very much. And on behalf of ACCC, I'd like to thank you all for joining us this afternoon to take the time out of your busy day to join us. As everyone knows, immuno-oncology is a new frontier for all of us in the practice of oncology. And so today we thought we'd go over some of the management best practices that are out there and to help your practices and institutions move forward with this new technology. And as Lorna said, we have the administrative challenges in immuno-oncology, potential best practices, in implementing best practices and preparing your practice for success and the use of these new innovative agents. Next slide, please. So immuno-oncology, what are the key administrative challenges in practice? Certainly we all know there's an onslaught of new information and we need to be able to manage that information not only for our clinical staff and supportive staff, but also for our patients, to ensure that all are educated appropriately with these new technologies and the nuances of implementing them within your practice or institution. Certainly, as we all know, reimbursement is a big piece of that, and managing reimbursement and the patient financial support and cash flow implications of new protocols will be very important as we implement these new therapies into our practice. And I'm sure most of us are on an electronic system, not everyone, but certainly whether you're on a paper system or electronic system, we'll need to update the practice protocols so that patients are triaged appropriately, particularly with regards to new or unfamiliar adverse events. Next slide, please. So, managing onslaught of new information for staff and patients and ensuring that all are educated appropriately. Next. So we need to keep up with new information. I love this graphic. It really, shows it's just the tip of the iceberg, as they say. And the current products on the market are just that. When you look at the manufacturer's pipeline, there are a lot of agents in this class and other similar classes that will be out in the next 1 to 5 years. So every few months we'll be expected to see a new agent hit the market, and that's certainly going to present challenges for us. And I think that's where ICLIO will be very helpful to educate and help practices as these new agents come on board and how we, so to speak, triage them within our practice and position them. So not only the new products, but how do we use these new products with other types of modalities that we have currently, whether it be traditional chemotherapy, some of the newer targeted agents, and radiation therapy. So as one can imagine, when we combine these agents, the toxicities can change, they can be magnified, what have you, so it'll be incumbent upon us to be aware of those combinations and toxicities and how to manage them. So how can practices and their staff keep up with the new information, stay informed, and make sure patients are appropriately educated? Next slide, please. So strategies for information management and education. I think it's important for each institution or practice to identify an immuno-oncology champion from among your physician staff to be the IO point person for product questions. Maybe it's the pharmacist within your staff if a physician isn't able, or maybe you have more than one person as a go-to person for immuno-oncology questions. It doesn't have to be a top IO clinical expert, but certainly the clinical staff needs to know, these reference staff need to know where to get information, and also to task these individuals with helping to coordinate educational efforts for staff. To identify an existing or new group within your practice to manage patient education. So certainly, you know, the patient education materials we have on board right now, we're going to have to augment, create new materials, and that's where ACCC and ICLIO will also help, along with industry support. To include the review of existing patient materials and the development of new materials specific to your practice. So certainly those materials will be very important for our patients and for our clinicians as we move forward. And as with anything, to find ways to regularly and proactively update your staff on new information, really to take advantage of the manufacturer-provided resources that are out there. Again, to take advantage of the resources that ACCC will develop for all of us. And certainly that will include on-site training or education from the manufacturer side and archive materials so new staff can be quickly onboarded to your practice's approach to immuno-oncology. Next slide. So reimbursement, and here's an area that we really need to focus on. I'm sure all of you have growing drug budgets. As these new agents hit the market, I know we've felt it in our practice. You know, our bi-weekly and monthly chemotherapy bill continues to grow with the release of these new agents, and I don't see it getting any better. So certainly managing your formularies and so forth is very important, and really to keep an eye on the reimbursement of these new agents. So this is going to be very important. Certainly most of us now with ACCC's guidance with the financial advocate programs that we have, most clinics and institutions now have their financial advocates on board, and they really play a very important role, not only in the management of immuno-oncology, as you know, but for everything that we do for our cancer patients. These individuals are unbelievable and really provide great support. And as I kind of alluded to, the cash flow and implications of new products. Certainly the release of these new products around the launch of ICD-10 coming up very shortly makes one pause. I mean, certainly we hear that CMS is ready for ICD-10. I think I worry more about the private payers being able to prove that they're able to adopt this new technology of coding. Will all tie together when you're looking at the reimbursement for these new agents. So again, this is going to be very important. Next slide, please. So reimbursement and finances. You know, new drugs don't come out with J-codes, and that's problematic for many of us, you know, with various payers. So the newest to market immuno-oncology injectables, infused products, you know, won't have those J-codes. They're going to have temporary codes. And so what we've seen is with certain payers that results in delayed payment for those new agents. One has to be aware of that. Sometimes the claims get denied or held up and we have to resubmit. We're all familiar with that. But with the cost of these agents, it's going to be very important to keep an eye on that. And there's a high demand now for off-label use of these new agents, and certainly that leads to additional reimbursement questions. I just came back from a conference yesterday in New York where I heard that even though payers will approve over the phone an off-label use of one of these new immuno-oncology agents, that they've been faced with denials. So I think it's very important to get in writing, if possible, when you get those prior authorizations for off-label use, because you know, I don't think any of us are rich enough to be banks and to bankroll outstanding debt and have our ARs climb dramatically with these new agents, so we really have to, you know, be ahead of that. And as I mentioned earlier, new combinations of immuno-oncology products with newer existing therapies will add to that complexity and financial overhead. So I think we can see that there'll be many challenges here. So how can practices ensure financial stability and viability while quickly making new immuno-oncology therapies available to your patients? And how can practices best ensure that they are reimbursed and that patients have the financial support that they need? Next slide, please. So let's look at some of the strategies for reimbursement and financial management. So one of the things, as I mentioned earlier, the financial advocates. Does your practice have enough financial counselors? We have 4 full-time financial advocates in our practice, 2 for a very large major site that we have, and 1 in each of 2 satellite sites that we have. These counselors pay for themselves, and they're really the most valuable part of my team, I would say, and that, you know, patients really can't get to treatment until they've met these individuals and their finances have been looked at, their insurance policies looked at, because the financial counselors can aid them in making sure they have adequate coverage, explain what the patient out-of-pocket expense will be. And if you're not sure you have enough of these people, it's a good time to really, you know, conduct an in-house analysis of your practice or institution and consider hiring on additional staff if you don't think you have enough staff to handle the current load that you have, and with identifying, you know, this new challenge financially with these new immuno-oncology agents. So just like you identify a clinical point person to help your staff with any questions that come up with immuno-oncology, it's probably good to identify a point person from within your financial or reimbursement staff to be experts or focus on immuno-oncology and understand the nuances of the various manufacturer programs, the copay foundations, and patient assistance programs to optimize reimbursement and patient support. So certainly the manufacturers have some of that, but it's important for your staff to understand what's out there. And as new agents come onto the market, there'll be other programs that they'll need to keep up with. So, you know, I see their roles increasing with the release of these new immuno-oncology agents. And then to develop an off-label policy for immuno-oncology therapies, suggested best practices. All off-label requests require predetermination. As I mentioned, I try to get that predetermination in writing if possible, so that you have something to go back with if you're denied. That patients are made aware of the risks and benefits, including the financial risk, and patients are required to sign. And you may get a lot of requests. Patients, you know, for an off-label use that may not be covered or authorized, you may have patients come to you that are willing to pay out of pocket for those therapies. So also to be ready for that, should that be the case. Next slide, please. So challenges and opportunities. Some private payers have been reported to be sending retrospective denials, particularly for off-label uses, even when there was a predetermination acceptance of use, which I mentioned earlier. So ensure that you have pre-approvals or predeterminations in writing when reimbursement may be in question. While manufacturer copay programs may not be available for off-label uses, some manufacturer-sponsored programs may be able to assist with benefits investigations, appeals, and general reimbursement questions. So certainly tap into these program resources and don't be afraid to ask. And as I mentioned earlier, patients may be willing to pay for these therapies out of pocket. So again, the financial advocates or counselors should be well versed in having that conversation with patients, in addition to talking about their benefits or patient support programs. Next slide. So what does ACCC have for resources in the financial advocacy realm? Certainly the value of dedicated financial coordinators, and you can see the website link there. ACCC's 2015 Patient Assistance and Reimbursement Guide that everyone should have. And the Patient Financial Advocate Position Description, if you're looking to add to your staff, another valuable resource that ACCC has for its members. So I would encourage everyone to take advantage of the resources that are there, and they're there for you. Next slide. So we talked about updating practice protocols so that patients are triaged appropriately, particularly with regards to new or unfamiliar adverse events. Next slide. So in updating practice protocols, as we'll learn, immuno-oncology agents have a potential adverse event profile that differs from that associated with chemotherapy or commonly used biologic agents. We've had a little experience with that before with a prior therapy used to treat metastatic malignant melanoma. Yervoy is the drug, but the company had some nice patient assistance materials and educational materials that I think are useful. In other words, if patients arrive in an emergency room having received these agents, either standalone or in combination with other therapies, I think it's important for those clinicians in the ER to know that the patient is on that type of therapy, and the nuances of those side effects could be quite different than they're used to seeing. So again, educating the patient so that they make sure that they tell anyone that they run into from a management perspective that they're on these new agents. Staff triaging patient phone calls to the practice need to be aware of potentially serious adverse events requiring immediate attention. So we're a practice that has a triage system. I'm going to have to educate first responders, to ask patients, are you receiving X, Y, or Z? Because that'll, a different tone on the conversation and a different message to my triage nurse that's going to handle that call. So your staff triaging personnel really have to be aware of that. And as I mentioned, if they go to the ER or other setting, those clinicians are going to be unaware of these adverse events. They're not going to be educated in immuno-oncology. And so we're going to have to help with that. And the patient is the first line of defense to help educate them, along with communication with other clinicians managing those patients, if we're aware of that. Educating patients and staff and developing protocols for patient triage and management will certainly help ensure that potential clinical events are quickly identified, managed, and mitigated. And I really can't emphasize how critical that is. As we learn through ICLIO and we learn about the adverse event profile of these new agents, you'll see that some of those toxicities, if not picked up early and managed early, can be fatal. And so we really have to be vigilant when we have patients on these therapies to identify those adverse events early, to make sure they're treated appropriately to keep our patients out of trouble. So have you updated your practice protocols, particularly with regards to triaging patients, to account for patients on immuno-oncology therapies and the potential associated adverse events? This is something we're all going to have to do within our practices and institutions to make sure that we can protect our patients as best as possible and make sure that they have the best possible outcomes. Next slide, please. So strategies for updating protocols. Our practice has a champion for regimens that are built in the ER. We would do the same thing for immuno-oncology to make sure that the individuals in your practice or institution who are responsible for building or updating the protocols within your institution are aware of the nuances of immuno-oncology therapy, and that they take the lead in identifying any practice protocols that may be impacted by the addition of immuno-oncology therapies in your practice. So depending on what system you're using, I mean, you probably all have ideas on the types of things that you want to get inside of those protocols that are critical for optimal patient management. And again, that's where ICLIO will help with a lot of this. Certainly to ask all patients on an immuno-oncology therapy, to clearly identify themselves as such and make sure that these patients can be quickly identified as being an immuno-oncology therapy, being on an immuno-oncology therapy in the chart or electronic health record tool. And as part of staff education, ensure that clinical and non-clinical staff understand and can identify the main potential adverse events associated with immuno-oncology products and know when these events are potentially life-threatening and or require immediate clinical attention. So I would say that a lot of us are very busy. A lot of us don't have time to, develop a lot of in-house educational tools right out of the gate. And those that do, that's wonderful. And I think with industry and ICLIO support, we can do that. And I think the manufacturers are more than willing to come in and in-service staff about these things, about the drugs, about the toxicities. And we've certainly taken advantage of that as a practice. And it's something, we might want to do more than once. And, they come in and introduce a new agent to our staff. But I think it's something, that we would probably repeat on a regular basis, to make sure that that awareness stays heightened and that people do not forget about these immuno-oncology therapies, their nuances and side effects that can present when patients are treated with them. Next slide, please. So we're at questions. So I think we've covered some very important topics in the management of immuno-oncology. I think we've really keyed on the major ones, and I'm sure the audience may have questions on other areas of practice concerning immuno-oncology. So we're very happy to take any questions that you might have. Thank you.
Thank you, Steve. All right, well, we're going to send it over to Ms. Jennifer Hinkle, who will pose some questions to you, Steve.
And will these slides be available for the people on the call, Lorna?
Yes, so the slides as well as the recorded webinar presentation will both be available. And I hope to have them up by tomorrow. And everyone who registered, as well as those who registered and were not able to attend, will also receive an email with the link.
Great, thank you.
So Steve, this is Jennifer, and I have a few questions for you. So the first question is, when you're hiring financial counselors, has this been something that is a challenge to do to find the right people? And what are some of the things you look for in the profile of a financial counselor when you're hiring?
So a great question. First thing I would do is certainly pull a job description that ACCC has developed for that position. Many of you that have financial advocates would probably agree. I think you need to have a very engaging person who loves to work with people and loves to help people. Certainly, understanding finances and insurance plans doesn't have to be mandatory. That would be beneficial. We have brought financial advocates and trained them with, my senior financial advocate staff. So I think someone who has a background with reimbursement or insurance, loves to work with people, is outgoing, affable, are the type of individuals that you want. Certainly, I'm very lucky. I think within my practice, I have 4 very good ones who do an outstanding job and are just really passionate about what they do. And then we get support from the rest of the staff. I mean, we do something interesting in our practice. We have a Jeans Day on Friday. Not that this relates to the question per se, but we donate $2 to wear jeans on Friday, and we keep that money within our practice to get, can be food cards, gas cards, all goes to our patients within our practice for assistance. So the financial advocates came up with that idea, actually, and that's something that's been very successful for us in getting money and assistance to our patients. But I think the main things are really to have someone who's willing to learn if they don't know this area, and again is really good with people and engages people.
Okay, thank you. And I have another question. I think this relates to the point you were talking about with all of the new information coming, as well as more and more patients being on these therapies. Do you have an idea right now of about what percentage of your patients in the practice might be on an immunotherapy agent or eligible for that, and what about in the future? Where do you think this is going?
So there are 900 clinical trials right now out there dealing with immuno-oncology. So we have 2 labeled indications right now, right? We have lung cancer and malignant melanoma, and there's a whole host of areas where these drugs have activity. We had our first off-label use in pancreatic cancer, I think, last week. So I think if you look at the patient demographics within your practice, I look at lung cancer as going to be a huge area, right? These drugs will be used in your lung cancer patient population. So practices, institutions should be able to have a rough idea on how many of those patients they see per year, roughly, based on their new consults with that diagnosis code. Certainly, metastatic malignant melanoma we see less of, but still another patient population. But just imagine this expanding to GU, to pancreatic, to breast, to colon, bladder, I mentioned GU. I mean, there's a potential for these agents to be used almost everywhere based on what I've seen for initial clinical trials that are out there. You know, we'll have to wait for the data to evolve to see whether these agents get approved in those various disease states. But as I think you could see from the presentation, this is going to explode very rapidly. And it's going to behoove us to be ready for it and to at least have mechanisms within our practice to triage these new agents as they come onto the market. And as you can imagine, a lot of things will come into it as you have competing agents. I mean, if you have agents in the same class, the PD-1s, and there's going to be another class called the PD-L1s, you know, which agents do we use where? I think that's where I think, excuse me, ICLIO and the faculty and the scholars will help with that. So I think we'll learn as we go, but I really anticipate these agents being used almost in all disease states, I mean the major disease states. So I look for it to get bigger and bigger.
Steve, thanks so much. And I have a comment actually that just came through and another question. So I'll share the comment first, and then if you want to comment further on that.
Sure.
And someone from the audience says, as an FYI, submitting the NDC code along with the miscellaneous HCCC code will help reimbursement until the actual code is assigned.
Great tip. That's very important.
And then actually, coming from that same person, she has a question and this is about ICD-10. While you're working on upgrading your practice management protocols to accommodate these IO agents, what are your recommendations for incorporating ICD-10 codes to help ensure reimbursement?
So I think we're lucky. I mean, it depends on what system you're using. We're fortunate that we have a system that already has the crosswalks built and already has warning screens that comes up right now. I mean, when my physicians pull up their patient list right now, there's a blue star next to every single patient that needs an ICD-10 code. So we're working on those already. In October 1st, there'll be a hard stop within our system in that the clinicians won't be able to do anything until the ICD-10 codes are put in. We just had a training session on that within our practice earlier this week, and I think it's an opportunity to clean up some of the codes as well. There may be codes that you have in your system for patients that are maybe now obsolete, no longer used, and so we really have an all-hands-on-deck approach with my billing department and my primary nurses really working with the physicians to get the right codes in, to get the codes cleaned up, because that'll really help your billing and financial office staff. You know, we have a really hard stop within our office on September 30th. You know, all of my clinicians are going to be here until all of their charts and billing are completed on September 30th. So if they have to stay here till 3 in the morning, they'll be here. And we're going to have prizes for the physician who gets their charts and billing done first. And if there are some that don't get them done by midnight, there'll be penalties. So we have some incentives and disincentives, you might say, but very important to have your vendors be on top of this. And so I can't speak for other vendors. I really don't want to get into, you know, which system's the best or X, Y, and Z, but our system just happens to have a crosswalk where we have those features built in.
Okay, thanks, Steve. I don't have any other questions that have come through. So, so I guess I don't know. Should I turn this back to Lorna? It's coming up on the half hour, so
sure.
People may want to go on to their next appointments.
Yeah, thanks, Jennifer. I did just want to address a couple of questions that came in just about the educational materials that ICLIO will be developing. I just want to give everyone an update. So as ICLIO develops, we are focused on addressing 5 domain areas or knowledge areas, and they involve the clinical optimization, coverage and reimbursement, management best practices, patient access and advocacy, and the training and development component. So we will be developing educational materials, tools, resources along the lines of each of those domains. So please stay tuned. We are working on particularly a scholars program that will involve learning modules around each of those different domains to really provide a snapshot or overview of comprehensive understanding of immuno-oncology as it relates to all of the different complex elements that everyone will need to know on the cancer care team. So that's really our focus with ICLIO, and we will have a lot of resources, especially coming up. So please stay tuned for that. And another thing I just want to point out too is that we have the first annual national conference for ICLIO, and that's going to be October 2nd in Philadelphia. And that's really going to be a culmination of all of these topics that we're talking about that are on the horizon and that the cancer care team will need to know, to make sure you have everything ready to line up, your strategy in place before the patients are even coming through your door, as I'm sure requesting these different agents. So we are here to help. We are here to provide resources, and hopefully you'll be able to join us for this first conference, again, where Steve will be one of our presenters as well. So please check out the agenda. It's on our website there. It's accc-iclio.org. So please check that out, and hopefully you'll be able to join us in Philly for that event. And as far as to conclude, I wanted to again say thank you to Mr. Amato and Ms. Hinkle for the excellent presentation, and to you all in our audience for participating.
Yes, thank you, everyone. Have a safe week and a safe long weekend, and thank you for joining today.
Thank you. And I also did just want to mention that hopefully you'll be able to join us next Thursday, September 10th at noon for our next webinar installment, and that will be very timely and relevant to what Steve was talking about, understanding how to manage adverse side effects associated with these IO agents. So we're going to have Jennifer Deal, who's the primary nurse for the Cutaneous Medical Oncology Clinic at Moffitt Cancer Center, join us as a presenter to really discuss the real-world solutions to managing these toxicities that are, again, unique to these agents. So again, please mark your calendars, and you can find more information on our website. So thank you again, Steve, and thank you, Jennifer, and thank you all, and have a good rest of the day.